Dear friends, next few minutes we will talk on peripheral arterial disease. See the case study. A 58-year-old male, type 2 diabetes for the last 24 years, a chronic smoker, 20 cigarettes every day, severe pain in the right leg, which develops when he walks for about 50 feet. Okay, so that is intermittent claudication. The pain subsides on taking rest. On examination, posterior tibial and dorsalis pedis pulses are not felt on the right side. So what condition is the patient suffering from? So it's a peripheral vascular disease. He is a diabetic. Now he is about less than 60 years of age group. He got the diabetes at the age of 25 years. Okay. He is a smoker. 20 cigarettes a day. And intermittent claudication. Posterior tibial and dorsal pedis are not felt. So it is a case of peripheral vascular disease. What investigations will you do for? So to know these vessels are blocked, Doppler. Maybe the peripheral Doppler or maybe the angio or peripheral angio. Okay. So what important advice will you give to the patient? That is the most important. So give him a chance. Do you want a cigarette or your leg? You want your leg? Stop smoking. You want the cigarette? Sacrifice your leg. Okay. So this is the very important here. After peripheral vascular. So the peripheral arteries affected are the iliac arteries, lower abdomen, leading to the legs, femoral and the popliteal arteries, that is the legs, and the tibial and the peroneal arteries, again in the legs. Renal arteries is a very common in diabetic individuals. So the unilateral renal artery stenosis, bilateral renal artery stenosis, etc. And subclavian arteries. So don't think that always the peripheral artery disease means the lower limbs. Sometimes the upper limbs are also very common. Axillary, okay, subclavian. So this is also very important. So the risk factors, especially the smoking, because it causes the vasospasm. It increases the production of the carboxyl hemoglobin and carbon monoxide, leading to the endothelial injury. Worsens the dyslipidemia, smoking. Smoking increases the thrombogenesis by decreasing the prostacyclin and increasing the viscosity and the clotting factors. Dyslipidemia, you have the high total cholesterol and VLDL, low HDL and low HDL2 cholesterol. Again, in the Indian population, we are having the low HDL cholesterol. Okay, that itself is a big risk factor for the dyslipidemia. So what are the risk factors of the PAD? Like your CAD or like your CVA. So diabetes, hypertension, hyperlipidemia, smoking, renal disease, and hyperhomocystinemia, hyperuricemia, etc. etc. See the difference between the diabetic and the non-diabetic. This is very important. So in the diabetes, clinical is a more common when compared to the non-diabetic because peripheral arterial disease is more common in the diabetic individuals. Younger patients, more rapid progression. Whereas the non-diabetics is a less common, especially the older individuals because of the atherosclerosis there. So less rapid progression, the insidious in onset and slow in its progression. Very sudden in onset and then the rapid progression is the diabetes. Male to female is the equal in the diabetic uncontrolled individuals, whereas the non-diabetic is more common in the males when compared to the females because more of the smoking habit is more than the males. Occlusion is a multi-segmental in a diabetic individuals. In a non-diabetic is a single segment. Vessels adjacent to the occlusion are involved in the diabetes. They are not involved in the non-diabetics. Collaterals are involved in the diabetics. Usually the normal collaterals in non-diabetics. Lower extremities are the both the lower extremities usually in the diabetic individuals. Usually non-diabetes is the unilateral. Vessels involved the tibial and the peroneal, whereas the aortoiliac and the femoral is in the non-diabetic individuals. So signs and symptoms, intermittent claudication, nocturnal pains, rest pains, non-healing ulcers, cold legs at the feet, absent pulses, color changes in the skin of the legs at the feet, gangrene, loss of hair on the legs, shiny atrophic skin, thick toenails, calcification of the blood vessels, claudication of the recipient may not be prominent in patients with the neuropathy. Okay, in those people with autonomic neuropathy or the sensory neuropathy or motor neuropathy may not appreciate these things. But these are the important signs and symptoms of the peripheral artery disease. See the toe here, third toe. Okay. Diagnosis, ankle brachial index, the peripheral Doppler. So less than the 0.9 indicates the peripheral artery disease. Here you can divide the period into mild, moderate and the severe according to the ankle brachial index. Okay, 0.75 to 9, it is the mild. Okay, 4 to 7.5, it is moderate, and less than the 4 is the severe. And less than the 4 is the severe, that should be subjected for the amputation. So in ankle brachial index, if the value is less than the 4, so immediately have to subject for the further investigations and the surgical consultations. Suppose if the peripheral ankle brachial index is 0.8, 0.75 or 0.6, you can treat by yourself by using the drugs which improves the peripheral circulation and statins, aspirin, silastazole, okay, cessation of the smoking, control of the blood sugars, etc. So that ankle brachial index will help you to decide it is a mild or moderate or severe. Arterial duplex color Dopplers, MR, angiography or multi-slice CT, peripheral digital subtraction angiography. So these are all the different diagnostics. Management, drugs like silastazole, I already told you, that provide a symptomatic relief. For clots, a thrombolytic drug such as warfarin or heparin may be used. Maybe the low dose, low molecular heparin you can use here. Angioplasty, so the balloon catheters, stents, stent grafts, atherectomy, laser assistance, even the cardiologist. So they do that. Now the vascular surgeons are available right now. So they also do these interventions. And sometimes they need the bypass surgery also. Thank you very much for your patient hearing. And if you have any queries, I will be very happy to answer them. Thank you. Thank you.